Okay, I'm very happy to present and represent our Department of Orthopedics in Bonn. So me and my new colleague Heva, we are sports scientists and also medical engineer here from Bonn, and we are working in the department of Dr. Pichikolan and Mr. Hess. For the movement analysis and then also training with patients. Our department developed since 2016 on this place where it's now. So developing is not only by name, because before it was Bewegungs- und Fußzentrum, so movement and foot center, because of the background of the two doctors. They were foot surgeons, but also by the team. So we increased our team member number by 3 more, so 1 sports scientist and also 2 medical help persons for our patient group. And yes, we have a big combination of modern technology from radiological examination, the movement analysis, and also clinical therapy on 400 square meters of the department in Bonn. And yes, our team, as I said, Dr. Pichikolan, who was first in Cologne and then based in Bonn because there wasn't such a department on specific foot surgery, and Mr. Joachim Hess now, who was also a trauma surgeon, and yes, the 4 medical assistants and the sports scientist now with an engineer of medical technology. This is our team. So the last photo we did last year, our combination changed because the 2 girls on the right side were now giving birth in some month, and now it was my pleasure to give all my knowledge I had to the new members. And yes, so this is us, and we are really working to be better each year. I see it as I saw it from Heva, who said that the workshop from EMG yesterday showed her everything she knew from us. So we learned from here and she learned from us, which is quite cool. And we all learning each year even more from your sides and from your perspectives, which is also quite cool that I can be here and get to know your department here. Yes, our daily workflow. So we have a quite close group of patients with mostly osteoarthritis, chronic joint pains and malalignments. We have mostly injuries by falls, neurological diseases, and nearly new or lately increasing numbers of forms of rheumatism. Yes, and if the patients come to the doctors, they get like a workflow for themselves. So we have the radiological side and then also the functional diagnostics, which are our part of the whole thing. So we have a gait lab. We also have the possibility to use isometric testing for the core with the proximate line, and isokinetic strength testing, mostly for ankle and knee strength. Yeah, but as you know, for the biodex you could test everything you'd like to. But this is the most amount of the patients. Yeah, and what is also cool that we can test ourselves. So if we got a therapy for the patients on the AlterG, for example, or the different strength machines, then we can also test if we did it quite right, or if we can get the results we wanted to from the gait analysis or the strength testing. And yes, this is what we do, and I wanted to present two different types of persons we have by showing you two different examples. The first example was a 66-year-old woman who was lately retired and showed a Genua vara, which is like an O leg for that who are sitting here, which is just the diagnosis of the doctors here, with a medial gonadtrosis with cartilage damage of 4th degree, and yes, reduced leg extension of the right leg. And the complaints were the pain during walking, and especially the stair climbing. And yes, while she was working, she hadn't that much time to train on some of her complaints, so she decided to come to us after having retired and train on her problems. So we did the gait analysis and the stance analysis and the isometric, no, it was isokinetic testing, sorry, for the knee joint. Yes, as you have seen on the stations here, we also use the EMG and the inertial sensors for the movement patterns, so for hip rotation and even hip and knee flexion and extension or the foot axis, and also the pedobarographie with the Noraxon software. And our normal setting for the patients with the lower leg issues, we have the EMG sensors for gastrocnemius medialis, peroneus longus, and the gluteus medius. Yeah, as you can see, this is what is the diagnosis, the Genua vara, which is can hardly be seen on the right side even more. So this was the stance measurement, and I think, yeah, you can see this is not striving for excellence now here. It's just for giving the patient the opportunity to move as she wants to. So her aim was to go on bike rides with her son, and also for walking even longer in her vacation. So this is what we are aiming at, and if the patient is then glad to work on something, we are really happy to do it with him or her. So this was the measurement for the gait. I just wanted to show the COP, so the center of pressure distribution, because I think it is quite nice to see what we worked on, because we had a reduced pressure on the heels for both sides, and even more on the right side where the knee had the bigger problem. And you can also see the diagram shows quite an unstable gait for this person. The stance measurement was quite good, so we didn't have to work on the stance itself or the stability, but on the dynamic type most of all. So we decided after the strength test, which we showed here for the results, I can show it here, that we had a difference of 42% for the right leg in extension, and flexion of 23%, that we also had to strengthen her leg for the right side. So we had like a combination what to train with her. So first she started her therapy in February of 2021. The first thing to do, if you also have the diagnosis with the osteoarthritis knee or problems with the cartilage, you need a knee brace in some cases. Not all, but this was the first thing to do. If she wanted to go home, she needed even more support, not only our training, because we could be there 5 days a week, but only for half an hour. So this is the first support with the brace for the medial unloading, and then we decided to do an alternating training load with a treadmill, so the AlterG, where she walked at 70% of her body weight, which is less enough to it is enough to decrease the body weight to make it easier for her to walk steadily, but not too much that she can't compare it to the all-day walking. And also the isokinetic strength training protocol we had to just strengthen the leg quite isolated for the right side. She left us after May because, as we all heard, we are dependent on the insurances. We had a in-between measurement, but I think it's quite interesting to see her the next year, because she was able to do some walking or even hiking, and also bike rides. And but we started another round for training, so the need race stayed with her. And we did a training load with also treadmill walking. It was now possible to increase the body weight and let it at 80%. And we focused on higher walking velocities and the steepness. So it is possible to use steepness on the AlterG, and then she could do even more exhausting exercises or even more exhausting walking. And we decided to make her do some strength training exercises with body weight, so she could practice it at home also. And we have the comparison from, as I said, February 21, and now this was, April 22, where she did the second training session, so the gait was more stable. So this is the right side. On the upper side, it's the mean or the average pressure. On the right side is the new or the latest results. This was the maximum, and for the center of pressure diagram, we see we have a more stable way to walk, although she could not place that much more pressure on the heel. It is better than before, but as we see, we have the condition of the Genua vara, which is not able to be trained away. So somewhere is high, so we can't do 100% of perfectness here, but it's okay. So she said she could do everything she wanted, and as we see here, so the strength came also because she was very ambitious and she really trained hard with us. And I think this is a good example that even your motivation can let you do something at home for your health, and this is what we are striving at, to give the motivation to the patient, because we can't be there all the time for them. Okay, second example, which is a little bit more interesting in the way that we have more difference from the start to the end, because this woman had a femoral fracture on the left leg from a skiing accident, and she till she came to us 4 weeks after the accident. She was just sent to us and wasn't a patient before, had a thrombosis prophylaxis, and yes, was then partly allowed to load the leg with 20% of her body weight, and came by wheelchair, or by car, and then to us by wheelchair. Yes, we started in March 2022, so this year. And yes, first of all, we couldn't do any measurement because she wasn't able to walk, so we didn't measure in this case, but we started right away for walking. It was allowed. We had the possibility to load 20%, and this is what we did, what the AlterG is able to do. And yes, it is also possible to read a little bit of load distribution between the legs through the pressure measurement of the treadmill inside. Yes, and even controlled knee bending because she was very afraid of the pain and also of not having control over the knee and the muscles. Yes, at the end of April, she had a control of to the X-ray and was then allowed to increase 10 kilogram each 3 days till the full load of body weight was then reached in mid-May. Yes, during this time she had 2 walking aids, which was quite cool that you could see that she is progressing through the days and was able to stand freely without help, but yes, her biggest fear also remained that she didn't know if she has the stability and the control over the knee and also the scarf at the hip, which was not that comfortable for her. So we decided after leaving the AlterG, because this is the next step, if you can walk like at 80% of your body weight, this is really near to your normal body weight then, and you also walk with the aids, that we change to the biodex, to the strength training, and also to gait training in our, in the room of the gait lab. We also have the possibility or the place and the equipment to train a little bit more at walking or even, leg strengthening. Yeah, and to see if we have the stability afterwards. So from outside it was quite stable. From walking we processed to the Über, which is our neuromuscular stimulation machine, which is putting load higher than or a little bit induced during a program to balance and orientation in the room. So we did one measurement in between after 4 months of training, and this was so the last measurement was 4 months of training, so we had it in August, and in July we had one biodex isokinetic strength test, so that we could see it here. This was the measurement right before she would have left us for the movement. So the pressure measurement is quite good. We have full contact with the heel on the ground, maybe a little bit less on the left side than on the right side, but not that much. You could also see that the COP diagram is quite balanced, and what I wanted to show is if we really look more into the measurement, we have 2 things I would recommend to her. So we have the IMUs, and we use it to see if we have the right flexion, during gait, and also hip rotation. And this is where she's not that parallelly measured to the right side. So this is what is need to be done. So the extension, the fully extension of the hip was not given in the case after passing here the red line through the 0 line. So the extension is not fully done. And also there's an ongoing inward rotation of the hip. So these 2 points would be parameters to train, but not at our department, because there was the end of the case, but at home or at the gym. Yes, and also for the isokinetic strength, we had a difference. This was April. In the extension, we had 50% less on the left side, and in the flexion, 30% about. And we did come very close to something, 11% for the flexion, but there was less strength on the extension on the left side. So this would be also an exercise for her. As you can see, if there's less strength in knee, would be the part where we extend also during the gait. So hip and knee combination could be better. So this is like a technical but also strength part. But in this case, as she is also a person who is doing her job and doing, or the aim is at being active again, this would be something I would leave to her, as we are also limited to our settings in the department. Okay, so the prospect, as we need then somehow the connection between the doctor's side or the medical departments to also the gyms or the personal trainers, who can then use these measurements for training with her again or further, because I think normally after 2 to 3 months the persons are quite okay with their stitches if they don't have any pain, and they won't work with it any longer. But we don't see them again if we do not recall them. This is what we do, which is quite good, that we ask for a control measurement after almost 6 months, so that we can say your status is okay, you did everything for your health, everything's fine, or we could now recommend for, this is quite the next year, then another training to come to us again. Okay. This is our work, basically, mainly, and you heard me before during GATE. There are so many possibilities to use, but also to mainly think about the measurements. But I'd like our department, just because we are measuring, we can control our training again, and we can give our patients to maybe any other therapist with based recommendations on our measurements.